The physicians stress the importance of listening to their patients' stories and the extent to which culture plays a role in their healing journey.
Right now, I'm working as a medical health officer, and I came to do that through a number of years in family practice first. I've always been interested in getting into upstream components to how do we keep ourselves healthy rather than how do we treat illness. My background is I was born in Calgary. I put up probably a bit of English, a bit of Scottish. Passions are, I really feel very passionate about promotion and prevention for health. And my passion around Aboriginal health specifically came from part of my training as a public health physician.
So Karin, can you tell us about your own personal journey toward Aboriginal cultural safety?
And right here within Canada, we have a population that has a curve very similar to what you would see in a third world country, and that really grabbed my attention and really gave me a focus on wanting to do something to change that. One of the questions that I always get is, why can't they get over it? That was so long ago. And I had no good answer for that originally, but there is such a good answer. And I think if you can pause and imagine yourself having been oppressed, having had your culture taken away from you, how you could become a healthy person.
Now, various perspectives regarding cultural safety exist. What does Aboriginal cultural safety mean to you as a physician?
For me, I think components of Aboriginal safety are taking the time to find out an individual's story, asking people's questions about where they're from, who they are as a person, as part of their health history. In both population health and I think in cultural safety, we have to look further back in someone's story to find out what things may have happened in their past, in their family's past, in their life journey that have led them to the place they are now. And I think the other thing I would suggest is understanding the impacts of trauma on an individual, particularly in the early years. We have excellent studies to demonstrate how that can impact an entire person's life story, and that trauma can pass from generation to generation. So in the emergency, everything's fast-paced, and you are trying to quickly take key things and put them into a category. You gotta categorize people. So when you do that, you really risk stereotyping people. And when we do that, we miss things, and it's not an intentional miss, but it's an unintentional categorization that is stereotyping, and it is a bias, and it can cause harm.